Northeast India is geographically, culturally, and ethnically distinct region of India, sharing international borders with Myanmar, China, and Bangladesh. In 2007, the Australian government provided financial support through UNAIDS to the Department of AIDS Control and the UN system to strengthen the HIV response in the northeastern states. Department of AIDS Control established the Northeast Regional Office, NERO, in 2008 to strengthen technical support to the northeastern states. The UN agencies complemented the national and state efforts through strengthening partnerships with various stakeholders. Legislators, faith-based organizations, people living with HIV, female injecting drug users, community organizations working with women and children, and other ministries. This was achieved through advocacy, capacity development, evidence generation, community mobilization, mainstreaming, and pilot initiatives.
NERO office of NACO that is stationed at Guwahati has played a very important role in the implementation and monitoring of this AIDS program.
The joint UN initiative worked with NGOs to establish targeted intervention for women who inject drugs. TB is 37 years old. She was using drugs since she was 25. She tried to give up drugs many times. She finally succeeded in 2013 with the help of opioid substitution therapy. Now, she works with Agape, an NGO, as a peer educator.
Inin tiyo do na hi swapin man lo joining upstairs mo ahim berkamana travel aom lo pon lo indu hun na phone number po in lang kan dun culture sarmayang atan tu me cha tu bipahian kan yam to sim to i dam doi edik kan lo ni chuan min hun yam le swalta kha ba kan me chebi kina me fidu bi kina ki mani minen ko na bi kan lo ni chuan kan ta chuan in hum him na anivet ka tamo ilam thato
amaro chu helai DIC fidu project bi helai DIC kan local hian nge mei chang kan lo ni ta engkim kan har sat na te kan in share nga vek ngam ta kan soi nge ta thok tu te po mei chia vek kan lo ni ta an ma ni chen tu na te po OSC te po ka share gai me lo ni ta chuan enge tin OST khera lo po service and pek shima here and tina hei needle syringe exchange te condom promotion te ting te acha enge kati HIV enge de na sik tam ta in kai chon thei laka et kanin ven thei pha acha kati
The Legislative Forum on AIDS complemented the efforts of the state AIDS control societies by bringing in policies to strengthen the response and mainstreaming HIV within other departments.
I have been instrumental to many activities and efforts made by the government in combating HIV/AIDS. In the last assembly term, that means 9 assembly, we have completed sensitization program in 60 constituencies. We have common public platform with the public people living with HIV/AIDS to discuss issues that affect them in both hill and valley districts.
Issue of the injecting drug users intervention program could have been tackled up with the help of the Manipur state AIDS policy, which was adopted and passed by the Manipur Legislative Assembly in 1996. With the help of this policy, we have taken up intervention programs for injecting drug users. Now, reduced to less than 20%, which was one time 76% somewhere in 1996. CD4 free of course. Investigation.
In Nagaland, the legislators forum were their main support system besides independent, programs, which was really helping the advocacy and sensitization program regarding stigma and discrimination.
Strengthening and supporting the people living with HIV to be actively engaged in decision-making and program design formed an integral component of the joint UN initiative. A certificate program on leadership and management proficiency for people living with HIV in the Northeast was designed and implemented through the Xavier Institute of Management in collaboration with Don Bosco Institute of Management. Feli and Maruati are leading the Positive Women's Network in Mizoram. They were trained under the LAM program. Feli lost her husband to AIDS 6 months before the training. The training gave her the support to go through the trauma and to find her own voice.
After the LAM training, I felt that the need of getting involved in the network so that I will be more contributing for the community people. The LAM training is really helping us in documenting our activities.
Training te kan nei ta tin chu ba ka chon en lo sum le pai la ma te en lo fundraising te kan nei ya khamia khan har sa swal te ifa in chan pu yang chi te tin ke ma ni ina self help group ang ve khan en lo bati te kan zwara khan khata sum lu dang te ka kan member sing a te khan har sa swal dam doi le na tu nei lo te ha kan pe chen bok ta.
We have different kinds of activities like support group meeting with our members and outreach, home visit, counseling, and even like experience sharing in the community, in the society, and even in the churches. We are advocating the students in the schools and even the teachers.
Mase result an chokha ke ma ber kha kalo ni ta sia.
Through a partnership with regional church-based agencies, the joint UN initiative worked with 24 local churches across the 4 focus states. Several churches allocated internal budgets for HIV-related activities, incorporating HIV issues in sermons, and made it a part of the Sunday school curriculum.
Every month we have fellowship with the PLHA, that is here in the church itself, and more than that we also conduct seminar, and we also visit some of the villages that is in rural areas far from here and do medical camp and health checkup, and we talk about HIV awareness, and we also talk about sex education, and also we also talk about the stigma discrimination. The church congregation so far now they are understanding about the acceptance of this PLHA.
There are also many PLHIV people among the Lota community, and before they started running away. But when this Illuminati started, people started slowly coming, and it has increased. It shows that stigma and discrimination is reducing in this church.
Into my heart, into my heart, come into my heart.
Under the joint UN initiative, early infant diagnosis was rolled out, and in Nagaland, a community-based initiative was supported for children infected and affected by HIV.
Ông ka. Kin ka se.
Anukha is 8 years old. He lost his parents when he was 1. He has been taken care of by his widowed grandmother.
School jashina janai.
Exam khatam se.
As I work in prodigal's home, I came to know that education support are very much needed for the infected and affected children. So when we had advocacy with the Sumi Baptist Church, so I link up with the Sumi Baptist Church, and Sumi Baptist Church, they have been sponsoring in education support.
Apa? Koi. Listen na le. Chito moto holi pi rop sarap business pi kurbu pare 1,500 laga. Aro baja khan nimite holi ami eku dikta nai. Temi ami nije pisara nai prodigal home khan bra ami ke duk dekhi ke na. Takhan nije ami help kuri ke na bacha itu sabo koi ke na takhan ab chite. Semba church para to whole year nimite school fee admission सब इनका ready कर दे अगले सन्ना ले मैं नमुरा तमती तय भल मानो होबो लगे तुम्हें जी होली भी मानो होबो लगे ऐसो पूरा तुम्हें के मुरुम कुरासी था